Hi everyone, my name is Jasleen and my social issue project is on maternal and infant mortality for Black Americans in the United States. So a quick outline of my presentation. First I'll be talking about what exactly the problem is, then going over the core and proximate causes, then I will talk a little bit about the state of the problem locally here in Fresno, and lastly solutions, especially those that are happening here in our community. So first, what is the problem? So 700 women die each year from pregnancy-related deaths in the United States, and that in and of itself is a really big issue. But today we're looking at the disproportionate number of maternal and infant mortality deaths in the Black community. So Black women are 3 to 4 times more likely to die from pregnancy-related death, and infant mortality rates for Black babies is twice that for white babies. So we see a really large racial disparity in maternal and infant mortality in the United States. What causes the problem? So there are two sides to this: the root cause, which is really the thing driving the problem, and then proximate causes, which are symptoms of the root cause that can contribute to or exacerbate the problem. So the root cause in this case is racism, particularly structural racism. And the symptoms or proximate causes that contribute to the overarching problem can be divided into two categories: socioeconomic and environmental factors, and then access causes. So I'll be going over each of these in the presentation, and we'll start with the proximate causes and then circle back to the root cause. So here is a nice flowchart that kind of shows the relationships between all the different causes for the disproportionate rate of infant and maternal mortality in the Black community. So you can see racism is pretty much the overarching cause, and then all of these symptoms delineated into two categories. So first we'll start with the socioeconomic and environmental category, and first is poverty. So in the United States, there's a pretty large racial disparity when it comes to people living in poverty. Black Americans and other people of color are more likely to live below the poverty line than white Americans. The risk factors associated with poverty include high stress levels, trauma, food insecurity, inadequate nutrition, living in food deserts, and those are all detrimental to the health of pregnant women and infants. A study showed that an increase in racial inequity between Black and white Americans in terms of employment led to an increase of 5% in infant mortality for Black babies. And we know that unemployment is a pretty big factor in determining if someone lives under the poverty line or not. So you can see that unemployment leads to poverty, and poverty can lead to an increase in infant mortality. So another aspect in the socioeconomic and environmental category is housing inequality. And housing inequality and poverty are pretty interconnected in that they're both contributing factors to cyclical poverty and generational poverty in the Black community and other communities of color. The biggest thing here is the legacy of redlining and how it affects residents' health. 3 out of 4 communities that were once subject to redlining continue to suffer economically. And we see that this manifests in unequal access to resources like green spaces, grocery stores, and hospitals. And without access to those resources, residents in these neighborhoods, there's health sufferers, and particularly vulnerable residents like pregnant women and infants. So next is environmental racism. You can read this long definition for environmental racism, but it's basically laws, regulations that deliberately target certain communities, often poor communities and communities of color, and create toxic living environments. Black Americans disproportionately live in these areas affected by environmental racism, high levels of air and water pollution, waste dumps, polluting factories, and there not being very many green spaces. And so unhealthy living conditions such as these lead to higher risks for asthma, diabetes, and preterm birth. And we know that children born preterm are at risk for fatal complications. So next, the other section of proximate causes is access. First being access to healthcare. So there's a high rate of people being uninsured or underinsured among Black women. And we know that if you have health insurance, then you have pretty consistent access to healthcare. But that leads to better healthcare overall. But without health insurance, it's hard for people to access care and afford care, and therefore that's detrimental to pregnant women's health and the health of their infants. Next is access to quality healthcare. So even if a woman is insured, that doesn't mean that the healthcare she receives is of high quality. One pretty glaring statistics is that in New York City, a study found that in New York City, 65% of white mothers compared to 25% of black mothers delivered their babies at hospitals with the lowest rates of maternal morbidity. And that's just one study that exemplifies how even if black mothers are insured and can access healthcare, that healthcare isn't always of the highest quality, the kind that white mothers have access to and can afford. So overarching all of these proximate issues that I just addressed in the environmental and socioeconomic category and the access category is structural racism. So all of those factors were symptoms of the larger root issue. Structural racism is racism and discrimination that's built into the systems and institutions of our society. Historically, black people have been victims of medical racism and government-based experimentation that informs a lot of the structural racism they face in the healthcare system and in our society today. One pretty big factor resulting from structural racism is just the stress and trauma faced by black women just living in America. This quote from Dr. Venice Curry states that when you add institutional and structural racism, whether you acknowledge feeling stressed or not, your body can still respond by releasing cortisol and stress hormones that, over time, can wear your body down and make you more vulnerable to chronic diseases like hypertension and heart disease. So just living as a black woman in America, whether you're facing overt racism and discrimination or struggling with some of the proximate causes like poverty and environmental racism, the stress and trauma faced from that is detrimental to the health of all people, but especially vulnerable people like pregnant women. In addition, black women face a lot of racism in healthcare. Serious prejudices such as ignoring pain levels and not providing the adequate standard of care. A study entitled Listening to Black Mothers in California found that 10% of black mothers reported mistreatment from maternal health care providers compared to only 1% of white women. So there's a real ingrained racism in our healthcare system. When black doctors deliver black babies, there's also a significant decrease in infant mortality. And so that goes to show that when babies are treated by doctors of their own race, there's not that ingrained racism and they receive better care. It's a pretty glaring statistic. Black babies are 3 times more likely to die when delivered by a white doctor than white babies when delivered by a white doctor. And here we can kind of see the Fresno perspective when it comes to this issue. In all of these orange boxes, you can see similar statistics to the national level of infant mortality for black babies. And I just want to point out in particular the statistics of infant mortality and preterm birth rate in West Fresno. And the West Fresno community faces a lot of environmental racism and has a pretty high population of black residents. And you can see the infant mortality and preterm birth rate is much higher there than the rest of Fresno County. But there are solutions being put forward by community advocates, particularly in the black community. So the Black Infant Health Program is run by the Fresno County Department of Health, and it creates an affirming environment for black mothers to raise their infants. It's a free program serving all African American women in Fresno County and provides a plethora of services, from education to more material things. And it also tries to connect mothers with resources to foster their personal growth outside of motherhood, and they're seeking to raise the level of health in the black community for black mothers and their infants. Another aspect of the Black Infant Health Program is the doula project, and the doula is a woman with expertise in the labor process, and she provides postpartum support as well as support during the labor process, and also acts as an advocate for the mother. So that addresses the kind of ingrained biases and racism in the healthcare system by acting as an advocate for the mother during her birthing process, and securing her own health, and when a birthing mother might not be in a position to advocate for herself. And this is again part of the Black Infant Health Program in Fresno County, and is working to support the Black community and decrease the rates of maternal and infant mortality. So in conclusion, the disproportionate rate of maternal and infant mortality is a major issue in the United States, and there are many proximate causes, but the root cause is structural. But solutions put forth by Black community members for their own communities are working towards addressing both the proximate and the root causes and decreasing the rate of maternal and infant mortality in their communities. So that's it for me. Thank you guys.